So Lorna is from Nebraska, and Lorna says, my daughter was diagnosed with hyperthyroidism, and she's 16. I also have another child who's 10 years old. There was a time that I can't join her at her doctor's appointment because of my work and my other kid. Sometimes it's really hard and overwhelming for me, but I would always think the best for my children. How can a private patient advocate help with childhood cancer? I'm so sorry to hear about the challenges that you've been facing with your family, Nora, whether it's a chronic condition like hyperthyroidism or cancer. A patient advocate can help you find the best care and resources for your child, in addition to saving hours of time, which instead of you spending those times navigating through the chaos of healthcare, you can spend those times with side by side with your children and loved ones. We can help clarify things that don't seem to make sense, as well as help review medical records and obtain necessary appointments in a timely fashion. Those are just a couple of things that myself as a private patient advocate can do. Also, I can review medical bills and try to eliminate those unnecessary charges as much as possible. What's also frustrating is perhaps you find some type of treatment or procedure that you think is really going to be a strong next step in diagnosing or managing your care, only to find out that it's not covered by your insurance. Or maybe if you don't have insurance. Those are things that we can help navigate for you. Lastly, we can provide you with additional resources to help you and your child have the best possible care, quality of life, and experience during this difficult time. We are very networked and have a lot of different resources that we've used in the past that we're familiar with. And if we're not familiar with something, we're continuously growing our resources and researching it to get and learn and stay on top of new options available and resources and treatments.